Welcome to Doc Talk, a weekly podcast featuring Monument Health physicians addressing medical topics. Tune into your health with Monument Health.
Well, hello, everybody, and welcome to this first ever live podcast with Monument Health and Doc Talk. And I'm super excited to have Joy back. She was you were one of the original ones that I think we did back in the day.
Yeah.
And I was still getting used to it. And I know you came in and you actually kind of soothed my nerves a little bit, which was fantastic when we were doing this because I had no idea what to expect, and it was so fun to talk to you.
Thanks, Mark.
So I would encourage anybody to go back if you haven't heard that podcast. Did we do one or two of those? I think we did a couple together, didn't we?
Yeah.
It was a lot of fun.
It was a great time.
Yeah, so make sure you check it out.
Dr. Saney and I, we had a good time.
It was great. So thank you all for coming and checking this out here tonight here at the Black Hill Stock Show and Rodeo. And I can't think, Joy, of a better place really to do this for the first time, specifically with you, because when we think of the stock show, we think, even though we're in a city of 78,000 people, metro 150,000 people, this is still a rural area for us.
Yeah.
And you practice in a very rural area up in Custer.
Yes.
How did this all begin for you? Why did you choose to be in such a, relatively small town?
Yeah. It's interesting because as I was sitting here talking, I have talked, you've seen me talk to almost every
lots
person.
of people.
And I kind of had this, like, can I make 1 degree of separation? Like, can I say one thing and connect somebody else to it? And I was able to with everybody I talked to. I was speaking to this couple down here from Chadron, and we have a ranch between Edgemont, South Dakota, and Harrison, Nebraska. And we're 30 miles on gravel from Edgemont. We're 30 miles from Harrison. My family still ranches out there. My sister Jody and her husband Brad, and now it's Jared and Joel are out there with their wives and children. And then my sister Jolene is actually next to them. She's also a doctor, and she drives over through Harrison, Nebraska to Lusk as the only frontier doctor over there. And so we started there, and when you end up that rural, you kind of want to go back home and take care of, I call them my people, like these are my people.
So this is in your blood.
It's in my blood.
This is literally where it came from.
Yeah. I just look like a doctor. I'm actually a hog wrestler. I'm retired now, but.
So what does a day, your day-to-day look like then? How would it differ from somebody that's working in a hospital in Rapid City or Rochester or Minneapolis?
Yeah.
How does that work for you day to day?
Yeah, I definitely never had a dream of doing anything like that, right? So
Really?
I never dreamed of that. I started as a certified nurse assistant in Crawford, Nebraska. And my mom really said, you really have a talent for taking care of older people. I've always enjoyed older people. My daughters, Nancy and Riken, they enjoy taking care of elderly people and just visiting with people with wisdom. So when I went to med school and I interviewed, I was probably not at the top of my class. I was actually pre-nursing and then switched to pre-med. And my mom had a transplant in Denver. And there was a lot going on in my life. Mom was really sick. She was on dialysis. And I just knew that, honestly, I was called to be a physician. So when I applied, I had a great interviewer, and she said, you're definitely not at the top of the heap. Why should we take you in med school? And I said, because nobody you see today is where they're not from where I'm from, and they're not going back where I'm from. And it's really true. It takes a special person to practice not only in such an environment where you aren't just outpatient only. You're outpatient, you're ER, you're hospital. You can't a lot of time get a hold of specialists. You have to understand internal medicine. You have to do pediatrics, OB, gynecology. But that was important to me because we didn't have it when I was growing up. When we had an accident, my mom, for a nephrologist, she drove hours. She drove from the ranch to Rapid, which is 2.5 hours, to get medical care in blizzards. And sometimes, I remember Mom was 10 minutes late, and we were turned away. And that's why I'm so passionate at my clinic that I make my rules, because I know my people. I know if they've driven across muddy roads. I know if they're late because they had some tragedy at home, or I know if they need to, show up on time and they don't get to be seen that day, because we have those too. But they have to ask me first.
Right.
I know my people.
I think that's, you and I were talking a little bit here before we started too. And I think that is, I don't think a lot of people understand just how important that can be, because when you go see a doctor, you know what your expectations are. You're hoping to go there to get better. You don't have a relationship. Mm-hmm. And anymore, in talking with a lot of the doctors that I have with Monument, that seems to be becoming one of the more important things that these doctors are looking for. Yeah. It's not, you come in, I'm sick, I need a pill, I got to go. There is talking now. Yeah. There's lots of getting to know. Okay. And I suppose as a doctor in a smaller town like Custer, you've known this all along.
Yeah, I don't feel like it was a revelation to me, but this should be a two-way relationship, right? I should get as much from my patient interaction and get filled up just like they get filled up seeing me, right? So this shouldn't be, I go to work and I'm drained and I go home exhausted.
Right.
This is like a relationship that is very fulfilling for both of us.
Yeah.
And I think that's probably one of the problems right now in medicine, to be honest with you. People are getting dispassionate about it because they're rushed too quickly and because they don't have a deep understanding and they don't have a deep relationship, and therefore they are depleted. And that's too bad. You know, we need to try to change that about medicine.
So do you think that's one of the bigger barriers that kind of happen in medicine right now? Is that right up there for you?
Yeah, I mean, I would say, so, you know, I'm a professor through the University of South Dakota. And so I take care of med students, and this is part of the way in which we can bring people into rural areas, mm-hmm. right? They need strong mentorship. What we're realizing, and my partner Lisa Brown is really great about this too, we realize that people are coming out and they're needing these strong mentors. And we need that even when we're young, right? Even when we're in high school and things, we need a mentor that says, hey, you know, you seem really good at this, or you seem interested in this, let me put you on our wing, you know. So we have like a junior nursing program, and I run a scrubs camp for high schoolers, and we introduce them to medicine. But then even in med school, we bring those guys along. We bring them into rotations, and they see the connection. And when they see the connectedness, they have a tendency to choose rural medicine because we have this long-standing relationship. One of the ways I start a lot of my med school rotations is it starts at 8 a.m. or 7 a.m. or 6 a.m. and I'm like, well, I'll be at the cafe at 6. And I'll see you down there. And they're like, okay. But it's because I want them to see the old boys in the community. And every doctor who works in Custer has been sitting at that table with me at some point.
Right.
You know.
Well, how do you handle what's popped into my mind as you're talking about this and getting to know these people? And, you know, I think you when they come in, you know, their symptoms and what they're feeling, you have a good idea because you kind of know them personally.
Yes.
But how do you handle cases that need this specialized care? Because you're an hour from Rapid City,
yeah.
right? That would be the closest for you. So somebody comes in with something that maybe you haven't seen before. How do you handle that?
Yeah.
In such a small community?
This is a very real issue because Jolene, my sister-in-law, was talking about this with me too. And these are not just cough and cold medicine cases. She had a case of somebody who couldn't move their arm, and there may be 3 months before you get that in to see a neurologist, and that is dependent on how good of a listener that neurologist is, mm-hmm. right? And so if then they say this isn't a big deal, or this isn't this or that, Jolene's so smart, and she has seen enough of so many things that she knew, you know, that's Lou Gehrig's disease. That's a rare form of ALS. And even when there was somebody that saw that patient and said, no, that's not what that is, she advocated for them, and she called a different neurologist in a different state and said, I know this is what this is. Will you then please see them? But that takes a lot of time, right?
Yeah.
And I have these very strong relationships with a lot of the Rapid City doctors. I've been very lucky because I trained here, right? Mm-hmm. I was here for 2 years, and they know my reputation. They know me. I have a bit of a bite, you know. If I can't get things done for people, I'm kind of aggressive. And I try not to be mean, but I'm persistent, right? And it's all because I'm just trying to advocate for somebody. And sometimes you can't always get things done. But I'll tell you the other thing we have. I have a partner sitting in the front row here who I love a lot. And we have really smart doctors. So if I can't figure something out, I pick up the phone and I call Dr. Saini, or I'll call Dr. Brown, and I'll say, I need your help with this, you know? Avery Sides down there, she's been practicing for years. I have people I can go to, and we put our brains together. And we have resources, technology ways. We have a great program called Up to Date. They update that in every disease state every 4 months. And you can get on there and read and learn, and that's our job as a doctor.
So speaking of technology, is it different for rural towns like Custer? Or do you guys have access to almost the same stuff as you would find other places?
I would say we have pretty good access from the technology standpoint on telemedicine visits, phones,
sure.
video visits. We have a great e-consult system through Monument Health with Mayo Clinic.
Mm-hmm.
So I can send a note to Mayo Clinic. They'll review the chart. Sometimes patients get confused, like this isn't a whole office visit. It's a very pointed note,
right.
But it does still help me. We don't have things like, for example, the very best MRI machine that we would use on prostates, right? That's only in Rapid City. So you have to pick and choose. And there are times when there might be a little bit better test in Rapid, but that patient can't drive, or they don't have any money for gas, or they're 87 years old and they can't drive in Rapid City. So you really have to know your patients so you can figure out how to best care for them. Because best care is not specialty care. No offense to all my specialists out there. I know this is going to be shocking. But specialty care is choppy care. Primary care, doctors who are in family medicine need to do their job with full workups before they see a specialist, so that the specialist has a concise report, data has been gotten, and they can actually then go through it very quickly and do their part. We need to all do our parts.
Are there? Absolutely, yeah, for sure. And I think you guys work very well together.
Yes.
The specialists and the primary, especially in this area. While you were talking about that, I was thinking, are there any issues or health problems that are specific to rural areas that you think that you see more of? I suppose we can talk a lot about farming accidents, things like that. But are there other things that you probably see more of than doctors in bigger cities do?
I would say we might see it in a different area, or in a different way. I would say functional alcoholism is a big problem in rural America. I don't think we see it the same way that other people see it. In town, you may see it as people who are, homeless or jobless. But we have a ton of people who drink pretty much all day long. They might be roping or riding, or they might be in the truck with a beer. But that is not normal.
Right.
Having a 6 to 8 cans of beer a day is not normal and not healthy. And so it's a touchy subject to kind of touch that with people sometimes. Also, there's a lot of people who deal with alcohol or deal with pain via alcohol, or they deal with grief via alcohol. I would say that's one, and then also late diagnoses, things that normally you would expect that person would have come in earlier. We have people who sit in the urgent care with 6 broken ribs because they did not want to, quote, bother us. And literally, you have to know if those guys with pearl snaps show up, the guy with pearl snaps gets moved ahead.
That sounds like every farmer and rancher I have ever known.
Yes.
They just, look, I don't want to be a bother. The bones are sticking out, but
Yes.
look, you got somebody with a runny nose. Let me
Yes,
take care of them
exactly. Yeah, the
first.
squeaky wheel gets the grease, and sometimes I'm like, hey, hi.
So how does, you've kind of explained it a little bit, but working in a tight-knit community like that, it seems like you have more advantages than some doctors do that work in bigger cities, for sure.
Yeah.
Do you feel that way?
I feel like that. I feel just completely surrounded by the community with love, and they're generous. They're generous to my children. They're generous to my family. They have a lot of love for us. We had a fire at our house on December 23rd. I can't not tell you how
Just
many.
recently?
This was 2 years ago,
Okay.
2 or 3 years ago. And people showed up for us. They show up for us in so many different ways. I just think that it is such a rich life, Mark. I just feel so lucky to have been placed in this place in my life, And that's not just Custer. That's Crawford and Shadron and Lusk and Ulrichs and Hot Springs and Provo and Pringle and Igloo. I just love that area.
The fact that you could rattle off all of those is pretty impressive too.
Yeah.
For sure.
Been to a couple of those late at night.
So when it comes to stuff like preventative care, you know, we talk a little bit about some of these farmers and ranchers that'll come in and be like, look, I don't need any of that stuff. I've been doing this my entire life, right?
Yep.
I'm fine. How do you convince them, like, look, maybe, I don't know, maybe that flu shot would be good for you this year, right? Is that tough to do?
Well, nobody will ever hear me say that, but let's talk about colon screening. No guy wants their butthole looked at, right? And so the best way to handle a rancher or a farmer is directly.
Yes, right, absolutely.
And the other way that is really helpful is to just be honest and open and truthful. And these take years of. I tell my children this all the time. Years of honesty and building a relationship can be broken with one moment, one lie, one mistruth, one bad referral, one bad day where you're running short with people. And so I think it's really important to have a very good relationship so that when you sit somebody down, you say, Joe, I need you to get your colonoscopy because I'm real worried about you. And they'll kind of lean in and say, like, you're worried about me. Yeah, I'm worried about you. Let me tell you why. Now, if you just go in there and you say, well, you need a colonoscopy, you need a prostate exam, you need a PSA, and my nurse is going to get all that arranged. They're like, I'm out. Peace out. Like, I'm going back to my cows. So it's all about relationship.
Right.
It's all about trust, just like the whole world runs on.
Do you feel sometimes, too, that you're kind of a psychologist to these people as well?
Oh, yes.
When they come in?
Yeah.
I'm assuming you weren't trained in that, though, in psychology, or were you? Do you have a background at all in it?
No.
It's just by listening?
Yeah,
purely?
actually, it's through a lot of, like, self-work and personal work and trials and tribulations. I realized that I had a lot of situations where people had died, and I didn't have the words, so I filled in the space with chatter, and I just did a lot of listening to podcasts, listening to books, and realized there were some things in my early youth I was doing wrong because I hadn't been trained in them, and I was young, and I didn't understand them. And the death of my own mom really helped a lot with that. I understood the vulnerability and the sadness that people felt when they're in the medical community. When you come into a doctor's office, there's like this massive power gap, right? The physician has the knowledge. They usually have the power in the relationship, and the person is feeling sick, vulnerable, scared, and they either are going to get a diagnosis or they could get a diagnosis that's very scary. So I think the psychology behind that is really, it's, for one thing, how does the room look? Where do you sit in the room? I personally feel like human touch is very important. I hug most of my patients. I touch their hand. I have no problems spending time with them. And I don't have to fill the space when somebody's sad. If somebody's lost somebody, I can simply sit with them and just hold space for them. Yeah. It's sometimes very sad.
Does it ever get easier?
Yeah, I mean, I think that knowing that you just want to be there for people makes it easier. I think the problem sometimes in medicine is that we believe we have to fix everything. And I have a really deep faith in God, and I know that I'm not actually in control. I'm just here to help them. I have a lot of knowledge that can help them, but sometimes it's not enough, and we just, at that point, need to not leave them.
Right.
We still need to be there, and we need to still be that solid rock for them that's going to be there.
Well, one thing we were talking about, too, before this, which I'm fascinated by this garden that you have up there in Custer. When you first said that, my first thought is somebody who doesn't garden is like, oh, great, she's growing a bunch of vegetables and things up there for people to, I don't know, pick when they wanted to. How big is it?
Yeah, it's 10,000 square foot, so it's a pretty big garden.
Heavens.
Yeah.
So this goes along with mentally helping people that have to be there.
Yes.
Right?
Yes. So somebody gave me this book. I think Larry Pillard, my friend, might have given me this book by the name of A Well-Gardened Mind. And it was a wonderful book that I was already practicing some of it, but I didn't quite understand how gardens really helped people. There's a science behind, like, natural killer T cells are increased by gardens. We know that, like, cholecystectomy gallbladder patients, when they were faced to a brick wall, they needed more pain medications, they had worse outcomes, and they got out of the hospital later than people who had an outside window viewing nature. And so even in ICUs, they have fake pictures of nature, and even that increases their immune system.
Yeah.
And so Dr. Brown and I, when we built our new hospital, really wanted to have a garden space, but I wasn't able to, we didn't have the money for it until one of our patients, Delmer Brown, left us money for it. And honestly, my kids have been, like, I could not have made it happen without Nancy Reichen and Lincoln, because they dug plants for me and they put those plants in, and it's been 5 years. But the beds look into the garden, not every single bed, but most of them. People can hospice in the garden. There's a playhouse in the garden. We take stroke patients into the garden and they can feel the lamb's ear on them. They can smell the lavender. And what it does is it makes people more aware of their senses, right? So we can treat anxiety through present moment, feeling senses, seeing things, smelling things. Well, how anxious are people in the hospital, right? So it's really helpful that way. But it's also there for the community. Like, kids who don't have a playhouse now have a playhouse. That's nice.
It does. It sounds, I love that approach to it anymore, where, like I said earlier, where it seems to be that doctors are understanding more of the needs that people have outside of just the diagnosis they're about to get.
Yep.
And the more doctors understand that, I just think the healthier in general and more at ease we're all going to be going to doctors.
Yes.
Because we still have so many issues with people just not, in a way, not wanting to bother anybody. I don't want to go because I don't want to be a bother, and I don't want to, get off the couch. I don't know. But yeah, this really seems like the right approach, I think.
Yeah, I feel like it is the right approach. I mean, if anything, I just really hope we can grow rural medicine more and more. I look at places like Newcastle, and we had some great physicians over there, Dr. Franklin, Dr. Reimer, and they put in years and years of hard work and time, yet if there's not, it's like a ranch. If there's not a generation beneath you, you're not going to continue to exist. And one of the things that's hard for farmers and ranchers is giving up power to the next generation. And physicians have that trouble too. So we have to act as mentors and wisdom givers, and we have to work with our young colleagues to teach and grow them and be there for them, just like a parent would be, where they feel a safe harbor. Right. Where when they don't know all the answers, they don't have to pretend they know all the answers. They can say, I'm not sure, but I've got somebody that I can pull in here and ask, and I'm going to ask them.
Do you feel there's things that, let me put it this way: what do you think needs to improve in rural health care? Do you have a list of things that you would like to see improve?
Not really a list. I mean, access is always a problem. We just don't have enough people going into it. And I think that the younger generation would like to do just outpatient medicine. And so I've had to wrap my head around that a little bit, because I was so excited to do all types of medicine and rural medicine. I'm not sure that's what the next generation is going to be interested in.
That's a good point.
Yeah. They want a lot of work-life integration balance. I didn't have that.
You were just all in, no matter what.
All in.
Do you think technology is going to improve for healthcare, for rural healthcare? Do you guys see more and more of that? I mean, being tied in with the mail and things like that, it has to be a big improvement.
Yeah, and I'm not completely opposed to technology. I want it to be used in the right way. Artificial intelligence can be wonderful in some ways, but if we have, I'm kind of a big libertarian in the fact that I don't want somebody listening to my private conversations with my patients. But on the other hand, I enjoy being able to Google something that's at the tip of my hands, and I can look something up very quickly compared to how I used to.
No, of course.
We have this thing called the Sanford's Guide, which is about antimicrobials. It's about antibiotic use, and it used to be like this big, and I got my new one, and it's this big, and that's just one part of what I do. So the knowledge that we have to have is amazing, and also, like, we're all on electronic medical records, right?
Yeah.
The good part of that is that you have information at your hands, but the bad part of it is there's so much you can't wade through it. So AI will help us to be able to wade through it and find that easier, I hope.
Boy, no kidding. So you must love just continuing to learn then.
Oh yeah,
as all of this
lifelong,
stuff comes on.
Lifelong learner.
Yeah.
Yeah. And I think actually at 50, one thing that's interesting is that I have this confidence of knowledge, especially like during, COVID and things like that. I wasn't going to allow somebody to argue with my experiential knowledge. That's my experiential knowledge. Nobody's going to tell me differently on that. But there's also this part of me that is just fascinated and knows that 50% what I learned the last 50 years is wrong.
Yeah.
And I'm okay with that. I just need to then grow and learn and change. You just don't know what 50% is wrong. That's handy.
Right. That is probably one of the most rural things I've ever heard somebody say, though, too, right there, for sure. Which is great because, I come from a very small town as well, and I grew up with that same kind of background, right? You never give up. You're always looking for an answer. You're stubborn as hell at 9 times out of 10, right? And you want people around you to feel happy and safe and secure.
Yes.
And so what you do in a town like that, I mean, it's got to be a good feeling too.
It
what
is
you
a good
do,
feeling.
right? When you go home at night, for sure.
Yeah, absolutely. I mean, right now both my girls are pre-med, and I think that the thing I'm most proud about that is maybe they go to med school and maybe they don't. That's not it. I don't need my kids to fulfill something within me. But what I'm most proud of is they have lived in a time during COVID that healthcare was miserable, and most people are leaving healthcare, right? But I have kids running towards a fire to put it out, and when I asked them why, they said, because we want to have the same relationship you have with people. They see it, and they see it's rich, and they want to do that. That's
awesome.
Cool.
Yeah, it is. Is there anything you wish more people understood about rural healthcare?
I think probably just understanding the constraints of their doctor being human. Doctors have bad days. I cannot tell you how many times that I went to the hospital first thing in the morning and somebody died, or somebody who I really deeply loved had a terrible diagnosis. And the next room I walk into, I need to be like, hi, how are you? And I need to be able to let that last person go for just a little while, because the next person doesn't need to know that and doesn't, they need the full 100% of me. But that is a learned skill that you don't have when you are 28 or 30 years old.
Right.
So the 50-year-old Joy Falkenberg is a different version than the 30-year-old, and we have to be generous with people. Doctors need you to actually show them love and care too, so that they stay in the field and so that they continue to have these relationships that are rich with their patients.
Right.
Yeah.
I mean, because without you guys, we're in trouble.
Yeah.
I'm just.
It's true.
I'm going to throw that out there.
Yeah.
Well, Dr. Joy Falkenberg, thank you very much for coming and doing this very first one.
Thanks, Mark.
This live one that we had. It was so much fun to talk to you. And, of course, I'm glad you showed up as well.
That's right. Shout out to Dr. Saney down there.
Yes, exactly. So I want to thank you very much for coming in and, anytime. Let's do it again.
Let's do it.
Because you're great to talk to, and I really
Thanks,
appreciate
Mark.
it. Yeah, thank you very much. Dr. Joy Falkenberg, everybody, thank you very much. Now, if anybody has any questions for Dr. Joy, she'd be more than happy to take some, too. Right now, it's a good time for your husband, Dr. Joy, to ask whatever he can.
I was like anybody but Matt.
Are you taking new patients?
Oh, I really appreciate you asking that. I'm not taking new patients. I actually, I am working 2 days a week now for the last year and a half because I have the same disease my mom had. So unfortunately, I've had to cut back quite a bit because of that. It allows me kind of a richness. That illness allows me a richness in my life that I'm very grateful for. But the downside of it is I don't feel very well in the afternoons, and so I've really had to cut back my practice a bit. We have a new doctor, Dr. Connor Weiser, and he's awesome. And we're taking another new doctor again next year. And I think if we continue to have strong mentorship in Custer, we'll continue to have more doctors like that. So I appreciate the question.
So speaking of those new doctors, how do you guys think, in your experience, how did you successfully recruit those doctors? Are they from the area? Why were they interested in coming to a rural area?
That's a really wonderful question. I really appreciate it. So I'm a professor through the University of South Dakota Medical School, and I love my medical school. I only teach for my medical school. And I feel like we start really early in the process of first-year medical students from the University of South Dakota come to USD, and they get to choose a doctor in the area. And they get to get a sense of family medicine and rural family medicine. And then as their second year comes on, they have a 6-week rural rotation. That a lot of people have come and seen me for first year, second year, third year. Dr. Saini was one of my resident physicians. Dr. Brandy Terup was a resident physician with me. She's at Southern Hills down in Custer there with us. Dr. Connor Weiser, who's with us, is actually out of Colorado. And one of the things about rural healthcare is that the rural health stipends that the government gives are actually quite important. They can get a lot of their loans paid back, but by then I have like my hooks in them, and they love our community and they'll stay. So those are really important. Almost all of the people that we get in Custer specifically have a pre-existing relationship with a physician. When we recruit physicians, we recruit them at my house. We have pot roast at my house with my friends, and I'll walk them around town. I remember Heath Waddell, who is over in Sundance, Wyoming now. I recruited him because I walked around town and talked to John Carson at Carson Drug, and I went in our Lynn's Dakota Mart, and the magic that they see you have with other people, they know that there's something that they want there. And if that person doesn't recognize that, if they're a recruit that doesn't like that, they shouldn't be there actually. We can't afford to have doctors who just want to be completely incognito. You know, I understand everybody needs their personal space, but if you want to disappear after work, it's not a good place to work. And then giving them the support they need once they get there with personal relationships is really important. I just want to, can I just mention that my best friend in the world is here?
Yes.
Besides my sisters. Michelle Lehman's here, and she has worked with me for 25 years almost. And she's an occupational therapist. So one of the things that makes us so great is this interconnectedness of, they asked me during med school, how would you answer this question? They said, what does it mean to be a multidisciplinary team? And I was like, I have no idea. I mean, I literally had no idea. I thought, why would you ask me that? I've never even been part of a multidisciplinary team. But now I wish they'd answer, hey, USD Med School, will you ask me that again? What it means is that nobody can do their job by themselves, right? Like, we all believe we can do something by ourselves. I cannot take care of a stroke patient by myself. I can diagnose a stroke. I can find that it's coming from AFib, but I need cardiology to do the ablation. I need anticoagulation clinic to help me with the Coumadin. I need Michelle to help rehab them, right? And so these deep partnerships and relationships is what makes you great, and we need to nurture those and grow those. And that is the responsibility of our organizations. That's the responsibility of Monument Health, to create a culture that does that. And Monument Health is working very hard to do that, to create that positive culture.
They are, absolutely. All right, any other questions? Thank you guys very much for coming out and watching this. We really appreciate it. And Joy, again, thank you. Very
Thanks,
nice
Mark.
to have you back on again.
Have a great night.
Thank you.